Hello everyone, today we are with Dr. Dudley and we're going to be speaking about LANAP. So Dr. Dudley, what is LANAP?
Well, let's first start off, who needs LANAP?
Okay.
What is LANAP for? So, if you're 35 or older, about 75% of that population has some form of gum disease, whether it be gingivitis, which is just a little bit of irritation and bleeding in your gums, all the way to full-blown periodontitis or a gum infection. So, there's many ways to treat a gum infection. Most common is cleaning, but what happens when you have a severe gum infection, like moderate to severe periodontitis? A cleaning is going to get the top of everything clean, but who gets down to the bottom? Correct. Right? You have to get down to the bottom, and sometimes there's bone loss, and what if you want to regrow that bone? So the Millennium Company makes a laser, right? It's called the MVP Periolase, and it has been shown in clinical studies and approved by the FDA to show that it regrows your bone.
Wow.
So for all the people out there that have bone loss and they've been through multiple deep cleanings, and every time they go, oh, you need another deep cleaning, we still have all these issues, a way to kind of, tip the scales more in your favor is to use the laser, right, which instead of just cleaning, sterilizes those pockets, kills those bacteria, and allows your body to regenerate its own bone.
And does that go up, does that affect the upper layer of the gum, or does that go below?
So it's everywhere. So it goes from the bottom of that pocket. So when we're looking at a tooth and we're using that little measuring device when your hygienist goes out and calls out those numbers.
Pericharting.
You've got pericharting, you've got 3, 4, 5, up to 7, 10,
Wow.
The laser, the filament is so thin, it can go right along the tooth and go to the bottom of that pocket. When it reaches the bottom of that pocket, the laser light actually penetrates 6 millimeters past it,
wow,
killing all the bacteria in the area, which then allows your body to heal itself, essentially.
Right. So prior to coming in for this procedure, is there something that they have to do, the patient has to get done before getting this treatment?
Well, prior to, you need a proper diagnosis.
Okay.
Right? So there's multiple different types of gum disease. You need to see a dentist, you need to have a full set of x-rays, you need to have a periodontal charting done, we need to check and see where are you on this continuum of healthy to diseased. Once we figure it out, then we can make a proper plan for you. Some people don't need the laser. Some people, if they have mild periodontal disease with not a lot of bone loss, they can do scaling and it can work well for them. If you just have gingivitis, there can be a combination of cleaning and the laser used at a different setting to help your body respond better to those therapies.
And how many therapy sessions does one have to do? Is it like done during one session? Is it for an hour, 2 hours?
So generally we have 2 sessions and they're about 2 hours each.
Oh, wow.
So we do half your mouth at a time. They can be done all in one visit, but it's a little bit much.
Right.
Yeah.
Okay. And then after the patient has completed this, they would have a post-op or something?
Yeah.
Okay.
So after you've done the laser therapy, of course, the most important thing to maintain any mouth healthy is to make sure that you come and see a hygienist every 3 months and get your teeth cleaned. There's no magic wand in dentistry, unfortunately. We can't just bonk you on the head and then you're done forever. Everything in life requires maintenance. Yes. Your lawn, your bank account, your relationships. So your teeth and gums are the same. You have to maintain them. So the treatment takes place in 2 visits. You're seen afterwards for post-ops like you mentioned, and then the most important thing is maintaining oral health through frequent visits with the hygienist.
Alrighty, so that answers it. If you guys have any other further questions, go ahead and comment them below. We'll make another video in regards to LANAP. Thank you, Dr. Dudley, for your time. It was
You're
a pleasure
welcome.
having you.
Thank you, Gabe.
Yes, ma'am. Awesome.